I guess you can't imagine what videotape looks like. Perhaps some of you can't even imagine what half a century was like. What I want to do now is to tell you a bit about some programs called Doctors and Their Patients. These were made about half a century or more ago and were used as a lecture aid. I'd like to introduce you to the first one. The first one is called I Just Want a Certificate. These programs are made in black and white, but the themes remain timeless. See what you think.
Good morning, Mr. Williams, isn't it? What can I do for you?
Well, nothing much. I just want a certificate, really.
A certificate?
Yeah, one of those NHS ones.
But what's been the matter with you?
Well, middle of last week, I came down with flu.
Yeah.
I've been off work since last Wednesday.
Yeah.
And, well, as a matter of fact, I phoned your receptionist on Friday, because it was still going on, but since it's been this new health centre lot, like it seems you have to sort of gaze into a crystal ball as to when you're going to be ill, because she said, that all the doctors, you and your partners, really flooded out at the moment, nice to tell me you. And we are. And she said, we said, and if it wasn't anything serious, not to trouble you, and, well, I was getting better, and it was more, having a certificate to cover myself that I was worried about rather than my state of health, and, but then over the weekend it went down on my chest and I've had pretty dreadful bronchitis, and, well, I got so put off, by what happened on Friday, and to be quite honest, I thought your receptionist was quite rude on the telephone to me, and, so I just went out and bought some bottles of Benylin, because I reckon that's what you lot would probably give me anyway for it, and it's got quite like that. Well, I rang work up yesterday, and told them that I was just about all right.
Mm.
And they said, that I'll bring a certificate in with me, because, I lose pay, and well, it's got me down as well, and cost of living's going up all the time.
I appreciate that. Let me just you're getting better, are you?
Yeah, I reckon I'm fit enough to go back to work today, and
You see,
mind you, I wouldn't mind being checked out on it, because my chest is still a bit bad, and
you smoke?
Yeah, but I haven't been smoking since I've had the flu, but I get this funny taste in my mouth, when I'm ill.
But do you think the smoke got something to do with the chest?
Well, I don't know about that. I do suffer with the chest a bit, but I haven't been smoking for about 7 days now, and it got worse.
Well, I mean,
it got worse on Sunday.
Yeah, I appreciate that. But it may well be that if you are a smoker, you're more liable to get these chest infections, and that really you're only yourself to blame if when you get flu, it settles on your chest.
Well, I wouldn't say, I've only had myself to blame, well, as far as I'm concerned, I think all this sort of nonsense about, you should cut down on smoking, and putting the responsibility on the poor victim of the tobacco companies, why don't they hit the tobacco companies, why?
All right, well, let's leave smoking aside. And you're entitled to your opinion, but I'm entitled to mine as well, and if the medical profession believe that smoking is not good for you.
I agree entirely. I wasn't saying that smoking's good for you.
Yeah, well, I just said that aside.
When you do a heavy job, when you got a lot of worries and so on, when you don't know where you don't know where your next meal's coming from, the price of everything goes up, then it's quite difficult to give up smoking,
Well, that's only you can make that decision, but I don't want to talk about that now at the moment.
No, I don't either. You're always saying about how, that you shouldn't waste the doctor's time, and all I want is a certificate, so, cover me for.
Yeah, but I think that, do you remember I saw you in May when you had backache and you got better then and you wanted a certificate, and if you recall, I wouldn't give you one, and that didn't please you very much.
No, and now I got a very much bigger neck because I was only off for 3 days then with it. And I do every job, I don't sit there on the desk all the time. And
I'll give you a health certificate if I've not seen you when you're ill. and you're better now.
Yeah, but I tried to come and see you. I tried to come and see you on Friday. You know, and I get the doctor, unless it's...
I'm sorry, Mr. West, we are very, very busy at the moment. Some of my staff are off short, and...
So I get it in the net because you're busy?
Not at all, not at all.
No, but it is. What do you mean, not at all? You know, not only do I lose pay if I turn up without a certificate, having been off work with a perfectly justifiable complaint, having followed all the garbage it appears to be, because, you really got me caught in a double blind. I don't know how many other people get caught by the you lot churn out, or whoever it is who's responsible for churning out on the telly and so on, about don't trouble your doctor unless it's really serious and all that, and like that. I don't come in mugging you around with any old slip or anything like that,
I appreciate that, but
is me in genuine need, and...
Well, suffice it to say, I quite believe you may well have been ill, but unfortunately, I haven't seen you during this illness. I can't
you can see me now. You'll see me now. No, but I'm not better. I'm still partly coughing me guts up. And I got this. You haven't examined me or anything
I've been well enough to go to work.
So do I.
Well, what I would.
I don't want this to. I don't want to be off next week. Because I've got whatever residual infection or whatever you call it.
Well, I'm sorry, Mr. Williams, that I'm not going to give you a national health certificate. I appreciate your problems, but...
I don't think you do appreciate my problems at all, I've got a little flat, your surgeries are done something better in my front room. I haven't got all this fancy video equipment in my bloody front room.
Yeah, well...
I've got a broken down telly that I paid about $5 for, and the level of unemployment, is going to be about 1.5 million in a couple of months' time, and I don't bloody well want to be one of them, because I can't afford to be unemployed, and then what's going to happen then? You're going to have me, not only me, but a lot of other people who have been screwed over by this sort of thing.
That's any point seen on in this way, Mr. Williams. That's my final word. I don't think there's any point in carrying on with this conversation.
I am not satisfied with this, to be quite honest. Because, if you get sacked from work, and it is unjustified, or you consider it to be unjustified, then one can go and appeal to the Industrial Relations Tribunal, right? No, I'm sure that us patients have got some sort of rights, that we can't have our whole existences being completely utterly messed up by you lot, so...
Perfect options, Mr. Williams. First of all...
Well, a pen.
Yes, I've got a pen.
Have you got a piece of paper?
Yes. There's a spare piece of paper. Or there's a pen. You've got two options. First of all, you can change your doctor, a course of action I would strongly recommend. Secondly, do you have
I've been thinking the same way myself.
If you have any complaint about my behavior, you are quite entitled to complain to the Executive Council of the Family Practitioner Committee.
And what's the address of that, please?
It will be on your national health card.
Well, I don't happen to have my national health card with me.
Well,
it is rather an important matter.
May I suggest that you A, find it, or B, if you can't, my receptionist will tell you the address on your way out.
I'll ask your receptionist. I think she is slightly more civil than you. Thank you very much.
Good day.
So there we are. Was that a surprise? It was in black and white? A straightforward conflict between doctor and the patient. What issues did you think were important? Please put them in the comments down below right now.